Hello everyone and welcome to today's presentation on Hantavirus. My name is Catherine Heston and I'm your public health preparedness leader here in Grant County, and I'll be doing a quick little briefing on what Hantavirus is, different types, who's susceptible, and what symptoms do we need to be looking out for. So let's get started. Hantavirus, what is it? Well, according to the CDC, hantaviruses are a family of viruses which cause serious illnesses and death. Saliva, urine, and dropping of rodents is how it's spread, and in our area, the specific rodent we are going to be taking a look at is the deer mouse. Hantavirus causes HPS, which stands for Hantavirus Pulmonary Syndrome, and HFRS, which is the hemorrhagic fever and renal syndrome. It's important to note that there are two main types of hantaviruses. You have the New World and the Old World. We find New World hantaviruses mainly in the Americas, and it's usually associated with the Sin Nombre virus and the Andes virus. These ones are known for the Hantavirus Pulmonary Syndrome in humans. We also have the Old World hantaviruses found in Europe and Asia, and these are associated with the Sol virus, Hantan virus, Dobrava virus, Pumala virus, and Surima virus. These are the ones that cause hemorrhagic fever and renal syndrome in humans. As we are located in the United States, we're going to be primarily focusing on the New World hantavirus and how it's spread. In the state of Washington, the main culprit of spreading hantavirus is the deer mouse. If you take a look at that bottom right photo, you can see a deer mouse. It's dark brown with a white underbelly, and it's actually kind of pretty cute. They're found all over the state and like to live primarily outside in fields, forest areas, and grasslands. However, when it does get colder, they tend to seek shelter in homes and buildings and can be found in attics, crawl spaces, and behind your walls. With that being said, who's at risk? Well, any activity that puts you in contact with deer mouse droppings, urine, saliva, or nesting materials can place you at risk for infection. Hantavirus does not discriminate. You can be any age, any gender, and any ethnicity. However, I do want to make mention some occupations that have frequent contact with deer mice and have a higher probability of being infected due to their close contact. That includes farmers, military personnel, forest workers, and actually the occasional camper. Our next question that follows along with who's at risk is how do you get it? Short answer is you can get hantavirus by inhalation or close contact with contaminated material. It's important to note that the virus attaches itself to dust particles that can be airborne if disturbed. So if you can minimize your exposure, that is the best. So let's say you or someone you know has come into contact with an infected mouse or area. There's a couple things that you want to be looking out for. In HPS, early symptoms include tiredness, headaches, fever, muscle aches, abdominal pain, and these early symptoms can appear 1 to 5 weeks after contact with the rodent that's been infected. Later symptoms such as coughing, trouble breathing, and death can appear 4 to 10 days later after the earlier symptoms. In HFRS, early symptoms include rash, red eyes, blurred vision, back and abdominal pain, headaches, and fever-like symptoms, and these can appear usually within 1 to 2 weeks, but can tend to take up to 8 weeks for symptoms to occur in the earlier stage. However, later symptoms of HFRS include kidney failure, shock, low blood pressure, vascular leakage, and unfortunately death. If you take a look at those photos on your right, you can kind of see examples of x-rays taken that show what it would appear to be vascular leakage and a bit of an explanation of how pulmonary syndrome can occur. So what's your diagnosis, treatment, and recovery going to be like if you do experience symptoms? First of all, it's very difficult to diagnose just because it is easily mistaken with influenza, and the incubation period of HPS is 9 to 33 days, which may or may not lead you to take 1 to 2 tests, and that test being the enzyme-linked immune absorbent assay to detect the IgM antibodies and diagnose acute infections with hantavirus. The treatment can be a range of things from antibody therapy, intubating and ventilating if necessary, administering fluids, and monitoring your cardiac function depending on the severity of your hantavirus. Recovery is kind of just supportive care, ensuring you're getting plenty of rest and hydration and just treating the symptoms appropriately. Bottom line, prevention is key. If you can eliminate mice from getting into your home and buildings, that is your best bet for fighting hantavirus. Located on your right, I produced a step-by-step cleaning list of how to disinfect. I just want to thank you guys for your time. Feel free to take a look at that, and if you guys have any questions, feel free to contact me. Have a wonderful time. Thank you.